Hello, my name is Brittany, and today I will be informing and constructively discussing various aspects of arguably the most beneficial development in the medical field, vaccinations. This day and age, the facility of wide-range travel has made the spread of viruses easier and quicker than ever before. Opting out of vaccines can leave you defenseless to preventable diseases such as chickenpox, influenza, and smallpox. Even more severe, it can also make you more susceptible to hepatitis B and HPV, which are both leading causes in cancer today. Roughly 50,000 adults in the United States alone die from vaccine-preventable diseases every year. I hope after this thorough review of vaccines about how they came about, how they work, along with their benefits, you will gain a much better understanding of them as a whole and are able to form your own educated opinion regarding them. First, let's discuss where vaccinations originated from. In 1796, Edward Jenner introduced the first scientific method of vaccination. Jenner inoculated an 8-year-old boy named James Phipps. He scraped pus from cowpox blisters on the hands of a milkmaid whose cow had caught cowpox and rubbed them into a few scratches on James's arms. Days later, James became moderately ill with cowpox but was healthy again in a week's time. This showed Jenner that cowpox could pass from person to person as well as cow to person. It also proved that by being injected with cowpox, James became immune to smallpox. Jenner successfully tested his hypothesis on 23 more subjects, including his 11-month-old son. Edward Jenner submitted his research to the Royal Society, the world's oldest independent scientific academy, which they did not publish his initial paper. Ultimately, his vaccination was accepted, and in 1840, the British government banned the use of smallpox to introduce immunity and provided vaccination using cowpox free of charge. In the 19th and 20th centuries, fellow scientists followed Edwards' model and were able to develop new vaccines to fight current deadly diseases, including polio, typhus, and hepatitis B. Now that we know where they originated from, let's talk about what vaccines are and how they work. Before the development of immunizations, people frequently died from infectious diseases that have largely disappeared since. Multiple studies confirm that vaccines not only protect individuals, but result in an overall increase in immunity in their whole community. It is no exaggeration that vaccines are one of the greatest modern triumphs in the field of medicine. At the root, vaccines simply prompt a person's immune system to protect itself from a specific disease. When you're protected against the disease, it means you can be exposed to it without becoming sick. When exposed to one or more doses of a vaccine, it trains our immune system to defend itself from said disease. Let's discuss how it works. Most vaccines carry a modified version of the germ that is weak or dead. This aids your body to build antibodies to fight off this germ. Our body generally makes antibodies by either getting the disease or by getting the vaccine. When your body notices the invading parasite, it will produce the antibodies to fight the germ. And then it remembers this bacteria or virus and how to fight it, so in the case of future exposure, it can quickly destroy it before you become ill or die. Saving the best for last, let's move on to the benefits. Dr. Smita Bhandari said it best. The goal of public health is to prevent disease. It is much easier and more cost-effective to prevent a disease than to treat it. For every dollar spent on childhood vaccinations, it saves our country roughly $10.90. The CDC estimates that for the vaccination of children born between 1994 and 2018, it has saved the U.S. nearly $406 billion in direct medical costs and $1.88 trillion in total society costs. Although reducing costs is a huge benefit of vaccinations, eliminating diseases such as polio and smallpox is by far the greatest impact vaccines have had on our society. At its peak in the 1940s and 1950s, polio killed over 500,000 people worldwide every year. During the 20th century, the estimated global death count for smallpox was around 300 million. Thanks to the development of vaccines, no new cases of polio have been documented in the United States since 1979, and the last outbreak of smallpox occurred in 1949. Another benefit is herd immunity. Herd immunity is when a large percentage of a population has developed a resistance to a disease which makes its spreading exponentially less likely. The most vulnerable members of our society are the ones who reap the most benefits, like babies who are old enough to be fully vaccinated, elders with poor immune systems, and people who, even though they might want immunizations, can't due to certain medical reasons such as certain cancer treatments. Me being healthy keeps you healthy. After reviewing the history, benefits, and origins of vaccines, it is abundantly clear that the advancement of immunizations has provided countless benefits to our society's health, with little to no detriments that can be proven by data or science. Groups of people opposing vaccines, mostly are referred to as anti-vaxxers, are not only putting themselves at risk, but making the selfish decision to put others' health at risk as well. Despite almost eliminating vaccine-preventable diseases, there has been a rising count in diseases within the last 10 to 15 years, and this is a direct result of the refusal of vaccines caused by misinformation or religious beliefs and distrust in medical professions. Every individual has a responsibility to be well informed and well versed in the benefits of vaccines and the dangers in rejecting them. In order to keep yourself and others healthy and clean, make sure you get your vaccine.